Imagine a world where a robot can replace your knee with millimeter accuracy. A world where recovery is faster, less painful, and implants last longer than ever before. It sounds like science fiction, doesn't it? But it's already happening. This is MAKO robotic total knee arthroplasty, where futuristic technology and human expertise join forces to transform lives. Knee pain is one of the most disabling problems of our time. Did you know that over 654 million people worldwide suffer from osteoarthritis, according to the Lancet Rheumatology in 2020? For many, walking even a few steps feels like climbing a mountain. Traditional knee replacement has been life-changing for millions, but here's the surprising truth: up to 1 in 5 patients remain dissatisfied after surgery, as shown in a landmark 2010 study by Bourne and colleagues in clinical orthopedics. Why? Because every knee is different. Imagine 2 fingerprints, no two are alike. The same is true for our knees. Traditional surgery often relies on a one-size-fits-all approach. Even small errors, just 3 degrees off alignment, can lead to pain, stiffness, and early implant failure. That raises the big question: can technology fix what human hands alone cannot? The answer is yes, and it comes in the form of MAKO robotic-assisted surgery. But how does it actually work? It starts long before you ever step into the operating room. Using a CT scan, surgeons create a 3D virtual model of your knee, essentially a digital twin. This isn't just a simple X-ray, it's a personalized blueprint designed just for you. It allows the surgeon to plan everything in advance: the size of your implant, the angle of every cut, even how your ligaments will balance once the new knee is in place. A study published in the Journal of Arthroplasty in 2022 showed that MAKO reduces implant positioning errors by up to 75% compared to manual techniques. Imagine rehearsing a surgery virtually, then performing it with robotic precision. That is the revolution. Now let's step into the operating room. Here's the dramatic question: does the robot actually perform the surgery? The answer is no. The surgeon remains in control every step of the way. The robotic arm doesn't replace the surgeon, it enhances their skill. Think of it like a co-pilot, ensuring the journey stays on the safest route. If the surgeon's hand strays even half a millimeter beyond the pre-planned path, the robot won't allow it. That's precision no human hand can guarantee alone. A study in the Bone and Joint Journal in 2021 confirmed that robotic-assisted knee replacements achieved more accurate alignment and required fewer ligament releases compared to manual surgery. Simply put, the surgeon makes the decisions and the robot ensures perfection. What does this mean for patients? The difference is remarkable. Patients report less pain, quicker recovery, and more natural-feeling knees. Some can walk within just 24 hours after surgery. That's not just faster healing, it's life regained. A randomized trial in JAMA Network Open in 2022 confirmed that robotic-assisted knee replacement patients had better early functional outcomes and fewer complications. This isn't just theory, it's real-world science. Imagine going from struggling to walk to climbing stairs again, with confidence and without fear. But this raises another big question: are robots replacing surgeons? The answer is a clear no. Robots don't replace the human mind, they extend human capability. Surgeons bring judgment, empathy, and experience. Robots bring consistency, precision, and safety. Together they create a partnership stronger than either could achieve alone. Think of it like this: the surgeon is the pilot, and the robot is the autopilot system. Would you ever want a plane without a skilled pilot? Of course not. But would you want the pilot to fly without advanced navigation and safety systems? Definitely not. That's the balance MAKO brings to the operating room. And here's where the story gets even more exciting: MAKO is only the beginning. Today, it helps surgeons replace knees and hips. Tomorrow, it could guide delicate spinal surgeries, reconstruct shoulders, or even assist in brain operations. Each step forward brings us closer to a future where surgery is faster, safer, and more personalized than ever before. Every year, robotic technology becomes smarter, smaller, and more precise. Imagine a world where mistakes in surgery become almost impossible, where every cut, every implant, every step is guided with flawless accuracy. That's not just the future of medicine. That's the future of humanity. With MAKO, the line between science and science fiction is blurring. The future of surgery isn't tomorrow, it's already here today. A future where technology doesn't replace humans, but helps them achieve the impossible. And that leaves us with one final question. Would you trust a robot to help with your surgery? The answer might shape the way you see medicine forever. Because with MAKO, we're not just replacing knees, we're redefining movement, rewriting possibilities, and rebuilding lives.